Today we have Gail Gustafson from the TB Control Program, Public Health Seattle and King County. Gail is currently pursuing her Master's in Public Health from the University of California, Berkeley, and will graduate in August 2020 with an interdisciplinary Master's in Public Health. Since October 2020, she's been working at the Public Health Seattle King County TB Control Program as a part-time graduate intern. Previously, Gail worked at a Seattle-based global health organization, PATH, and also served as an AmeriCorps member at CMAR Community Health Center in Bellevue. She is originally from Green Bay, Wisconsin, but considers the Seattle area her adopted home. And Gail is passionate about using public health approaches to improve the health of our community. Thank you, Gail, for joining us.
Thanks for the introduction. So today I'll be talking about our efforts to increase rates of LTBI treatment among status adjusters in King County. Oops, sorry about that. So I have not had financial or other relationships with any commercial interest organizations within the past 12 months. And here are the learning objectives that were shared with everyone earlier. The first one is to describe and apply lessons learned from PHSKC's efforts to improve civil surgeon LTBI reporting and communication. And then 2, to identify opportunities and barriers for status adjuster engagement and linkage to care in order to increase LTBI treatment completion rates. So before I launch into my presentation, I want to just provide a few definitions since these terms might not be familiar to everyone. So a civil surgeon is an MD certified by the USCIS to perform medical examinations for individuals applying for permanent residency, also known as a green card. So the civil surgeon medical immigration exam is conducted in the United States. So I want to contrast that with a separate process for those who see a physician overseas before they immigrate to the US. And then finally, a status adjuster is an individual seeking to adjust their current immigration status to become a permanent residency, to become a permanent resident. And I'll also be referring to status adjusters as patients. So this is the kind of the flow chart for the civil surgeon medical examination. So the first step is the status adjuster determines they're eligible to apply for a green card, and there are various ways that they would be eligible. Next, they would schedule an appointment with a civil surgeon. And then during that appointment for tuberculosis, they do a TB blood test. And if that comes back negative, then they can proceed with the immigration process. If that comes back positive, then the patient needs to do a chest x-ray to rule out active TB disease. If the chest x-ray is abnormal, they're referred to the health department for further evaluation. And if the chest x-ray is normal, they're also referred to the health department, but via an online survey. And this presentation is looking at those patients that have a positive blood test and a normal chest x-ray. So there are about 40 civil surgeons in King County, and they're all concentrated, as we can see in this map, in the metro area, so there are none in Eastern King County. They are required by the CDC and USCIS to report LTBI results to the Public Health Department, and they must include the patient's contact info, the IGRA results, and the chest x-ray results. In King County, we used to have civil surgeons fax us the LTBI results, but in August 2019, we switched to online reporting. And you can see a screenshot here of our survey that it's hosted through REDCap. And the link is below if you want to go check that out and look closer. So for reporting in King County, we ask for a mix of required and optional information in the survey. I already went through the required parts, but what we're asking for in addition to those required parts is information on the patient's primary care provider, their insurance status, and whether or not the civil surgeon started the patient on LTBI treatment. we're trying to find a balance of collecting enough information to be able to conduct successful outreach, but also we don't want to ask for so much as to disincentivize reporting among the civil surgeons. So some of the efforts we've undertaken to improve civil surgeon reporting is to first ensure that all civil surgeons are aware of the reporting requirement. And we found in some cases that they are not aware of how to report in King County, or maybe even that they are required to report. So it's really important to follow up with the civil surgeons that we get on a list that's imported from the USCIS website. And then for the people who do report, we follow up with them via phone or fax if there's data that we're not sure about. So we try to just keep the communication channel open with the civil surgeons. And then earlier this year, I developed a frequently asked questions document to kind of explain what our health department is doing with the patients that are referred to us, and how we are requesting the civil surgeons help us in that respect. And we shared this with Civil Surgeon Practices last month, posted it on our website, and also linked to it in the survey. And just in the past couple of weeks, I've been doing phone call follow-up to the civil surgeon offices, mostly speaking with admin staff to just ensure that they received that communication and ask if they had any questions. So the patient follow-up goals are to, 1, ensure that the patient understands their diagnosis, to 2, recommend that they consider doing LTBI treatment, and then 3, if they consent to receive mail, we provide additional information in the mail, and there's kind of 4 different documents that we might send them. So we always provide a letter recapping what we discussed during the call. And then we provide an informational sheet on kind of comparing LTBI to active TB disease, and in their preferred language if possible. And then if the patient expresses interest in seeking treatment, we provide a referral letter for their PCP and include the Washington State treatment guidelines. So the hope is that the patient will take that letter with them to their appointment, and it will kind of facilitate the conversation about treatment. And then if the patient does not have a PCP or is uninsured, we provide a list of community health clinics in hopes that that helps them link to care. So here is a little diagram of the follow-up process with patients. About every 2 weeks, I download the data from our REDCap survey. I enter it into our database, and then we try to call the patient 3 times before giving up, and we do follow up in the mail with patients we're not able to reach. If we do contact the patient successfully, we administer an informal survey of questions over the phone. And then if they consent to both of these things, we'll follow up in the mail and or track treatment progress. And then we're also doing some follow-up with clinics directly, if the patient is okay with that, to track treatment with PCPs. So to give you a sense of the numbers that we're seeing, between October 2019 and April 2020, we had 226 status adjusters reported to us in King County. And here's a breakdown of some of the countries that are reported to us. So there are, in between October and April, there were 41 distinct countries, but shown here are just those with 3 or more patients reported. And you'll see that the second bar from the bottom is missing, and this is because country of birth is not a required field in our survey, so some civil surgeons choose not to fill that out. But you can see the highest countries are India and Mexico. So I just want to talk about some of the successes we've seen with the phone calls, and I want to note that the denominators for all these different indicators are different because each phone call is really unique. And since it's not required that the patient participate or answer our questions, we just try to tailor that to what the patient is willing to tell us. So over 80% of 200 patients that we called were reached successfully via phone, and around 90% indicated interest in seeking treatment. And then also 90% out of 113 did plan to discuss LTBI with their PCP. This does include patients who didn't yet have a PCP established. And we found that a really small number really just were not interested in treatment at all or did not want to talk to us. So that was less than 1%, around like 9 or 10 patients. Of those who consented to us tracking treatment, 36 were confirmed to initiate, and 14 of those so far have completed treatment. So those numbers might seem low, but again, we're careful not to push the patient to share information or allow us to track treatment unless they're comfortable with that. And we did send out about 132 letters in the mail to follow up on conversations. So I want to talk about some of the program level challenges. Definitely within the last couple months, it's no surprise that COVID-19 has definitely had an effect on this program as well. Patients have expressed fear that having LTBI might put them at a higher risk of complications from COVID. A lot of them seem to be delaying initiation of treatment until after things go back to normal. And then also some civil surgeons are just not seeing patients right now, so we're seeing lower reporting. One of the overarching challenges is just determining how to best communicate with clinics, with civil surgeons specifically, because it's often the administrative staff who enters the data, so they might leave things out just because they don't have that, they weren't in the appointment with the patient. So there's just kind of a chain of communication. It's hard to determine who to best talk to improve reporting. And then we have found that there's, among civil surgeons, it varies widely what their practices of recommending or providing treatment. So some patients seem to not even understand that the positive blood test and normal chest x-ray means that they have LTBI, whereas some have already started on treatment with the civil surgeon by the time that we call them. And then finally, there's really no formal authoritative agency actively enforcing reporting. So although the CDC mandates that civil surgeons report this, they don't really offer any explicit advice on what health departments are supposed to do with the information. And they don't seem to be actively following up with civil surgeons to ensure that they're reporting. So it kind of falls on the county to do that. And then some challenges for patient outreach that we've seen is that there's definitely a potential for miscommunication. And since all of the patients are immigrants or refugees, a lot of times English is not their first language. So we do use interpreter lines or sometimes talk to family members instead of the patient directly. And there's just an inherent risk that something might get lost in translation there. And then also they're all coming from very different cultures and have different thoughts about preventive treatment. A lot of patients that we call are not expecting our call. So as you would probably predict, that makes it a little bit difficult sometimes because it can be a little bit of a scary call to get. And then we notice that there's a lot of patients are a little bit confused about what LTBI means and whether that means they're infectious, whether treatment is required, things like that. A lot of patients have voiced concern that this result might affect their immigration process, which it doesn't, but receiving a call from the health department and knowing that they have this information can make patients nervous, understandably. So again, we don't want to push patients to share more information than they're comfortable with us. And then of course, we don't know how much LTBI treatment might cost, whether you have insurance or not. So a lot of patients express this as something in their calculation of risks and benefits of doing treatment. And it's a little bit difficult to answer those questions because we just don't know either. And our surveys indicate that around 40% of patients are uninsured or do not have an established PCP. And then, so finally, I just want to talk about some of the things that we're thinking about doing next or planning on continuing to do. So we want to continue to build relationships with civil surgeons because we find that the phone calls go the best when the civil surgeons do a thorough job of explaining LTBI and hopefully recommending or even starting the patient on treatment. We'd like to be able to refer patients to specific facilities in the county that provide LTBI treatment and more actively ensure linkage of care. Right now, it's a little bit more passive what we're doing. Some patients definitely ask us whether we have a specific provider that they should go to, and we'd like to be able to have more concrete answers to those questions. And then we could be also more actively tracking patient treatment initiation and completion. But again, there's that issue of not wanting to push too hard because we don't want to make patients anxious. And then we really want to continue sharing our experience and learn from what other counties are doing also, because this is just kind of a new area of work that I think there's still a lot to be learned. So here are my references. And I would love to know if anyone from a different county is on this call. I'd love to know what you're doing with the LTBI cases reported by civil surgeons. It would be really great to hear from you either now or you can get in touch over email later.